Welcome everyone to the Power of Together, Improving the Health of People with Intellectual Disability webinar. We're really excited to welcome you all here today, and I have the pleasure of introducing some wonderful people who are going to do a great job of covering some really important topics. Before we get started, I am going to pop a link into the chat here, and that is going to provide a live captioning link. If anyone has any trouble accessing that or viewing that, I've just put it in now. Please let us know. Okay, let's get started. So just some quick notes before we get started. I want to begin by acknowledging the traditional owners on the land that we all meet on today. I'm on the land of the Wurundjeri Woiwurrung people, and I want to pay my respects to their elders, past and present, and acknowledge the traditional owners on the lands that we all meet on. So wherever your land is today, we're on traditional lands, and it's important to take a moment to acknowledge the lands that we're on and recognize the lands and the owners of those lands. Now, just a little bit of important information before we get into the good stuff. If you have a question, you can add those in throughout the session. We will come back to them at the end, but you'll see on your screen there is a Q&A box. So please type your questions in there. You can type them as you think of them, and we'll come back to them at the end. After the webinar, you will also get an email recording, so please keep an eye out for that. If you have any issues, I am the person you should reach out to. So my email address is there if you're not able to chat with me through Zoom. Now, I have the pleasure of introducing, as I said, some wonderful people from Gene Equal today. Now, unfortunately, Julie is unwell and is unable to join us, but I would like to introduce our other wonderful panelists. All right, I'm so pleased to introduce our guest speakers today. So we have Emma, Ava, and Sky, all from Gene Equal, and I'm going to pass straight over to them to get us started today. So over to you.
Thank you so much, Tyler. And it's a huge pleasure to be here, and sorry for my last minute technical hitches, which is always great to get you really pumped before a webinar, isn't it? So I'm absolutely over the moon to be joined by my wonderful colleagues, Sky and Eva. I'm going to briefly introduce myself and then hand over to them. So my name's Emma. I'm a clinical geneticist. So I'm a doctor that trained in trying to understand why people may have health or learning difficulties. And if they've got questions about that, help them work through that. And I work at Sydney Children's Hospitals Network here in Sydney. And I'm also a senior clinical lecturer at the University of New South Wales in Sydney. And I'd love to hand over to Eva.
Thank you, Emma. Hello, everybody. My name is Iva Stenadová, and I work as a professor of special education and disability studies at the University of New South Wales. And I also have the privilege to lead the research agenda of Disability Innovation Institute, which very much promotes co-production. That means doing research together with people with disability, not as just object of the research. And I'm also very proud board member of Self Advocacy Sydney, which is organization run by and for people with intellectual disability. And I will hand over to Sky.
I'm Sky. I am a peer mentor and home and living champion at Self Advocacy Sydney. And I'm also associate investigator on the Gene Equal team working with Eva and Emma and Julie.
Thank you so much, Sky. The little note to our slides, we really want and embrace accessibility as much as we possibly can. So what that means that, for example, all of the members of our Gene Equal team did at least once training in Easy Read with Council for Intellectual Disability, or our communication is in Easy Read, and we also follow this principle on our slides. We have subscription to Photo Symbols, which we would like to accredit at the moment. And if you want to explore more about what we do, you can visit our website. This is our team, and our motto is nothing about us without us. And our Gene-Equal research program team, ever growing, combines researchers who have intellectual disability, researchers who are in the field of medicine and healthcare more broadly, and also educators, teachers, experts in disability studies. So we found this very powerful combination because everybody brings knowledge from their own area and own context.
And why we are all here today at this webinar from the National Centre of Excellence in Intellectual Disability Health is really as a result of the National Roadmap for Improving the Health of People with Intellectual Disability, which said that we can no longer stand by and see this huge difference in healthcare outcomes for people with intellectual disability and the rest of our population. That this is inexcusable, and we must think about new ways of working together to overcome these huge and shameful health imbalances. So it was really as part of that national roadmap that Gene-Equal was able to be funded for our national project, which we'll tell you about, but we'll also be talking today about some projects that we've been running with New South Wales Health, and we'd like to acknowledge the funding from New South Wales Health and from the NHMRC and all our incredible partners and advisors across this project.
Co-production with people with intellectual disability about genetics. So the reason why we're doing this is co-production means doing research together. People with disability are included in the research project. So that means we all get to share and do like to work together. We work to our strengths, and we all like have we all can share roles and have different roles, whatever works for us. And co-production can help solve big challenges in healthcare.
Thank you, Sky.
So this is busy Sky. But I do have to say though, one of Sky's emerging roles in our research project is keeping us all on our toes with her with her humor. And one of those is that we you know, like to come up with these crazy ideas of let's do a webinar with hardly any notice. And Sky's just doing an amazing job with some extra slides that she got last night because when we found out that Julie was sadly unwell and couldn't join us. So thanks, Sky, again for putting up with us. But this is really the heart of what we do with co-production, and I'd really encourage you to check out this amazing guideline, which Eva was behind with her colleagues at the Disability Innovation Institute at UNSW, which is really how to do co-production. And as a newbie to co-production, I thought, oh, that's, you know, we go and we talk to some people and we ask them what we should do. That's co-production, isn't it? And it's like, no, co-production is about genuine, authentic relationships that take a lot of time to build. It's about trust, and it's about that everything you do from the very start of the idea of what you're doing research on comes from the community that you're working with. And so for us, this came from talking with people with intellectual disability who said, hey, we need to do genetic healthcare better. And that's where that first idea came from. And we'll show you how we've then applied these 6 steps as we've gone on through one of our projects, which we're really proud of together, which is the Gene-Equal Toolkit.
Thank you, Emma. And I think Emma put it beautifully that we do what we decide on together, and it always comes from the community of people with intellectual disability first and foremost. And I think that what we would like to show you also is how co-production, if you do it, can take you on unexpected journeys. And so what we are trying to show in this busy slide, and big credit to Sierra Angelina Willow for creating this one, is that just from the very small seed, which was funding from New South Wales Minister of Health, when we talked to people with intellectual disability and they told us what they like and frankly, mostly what they don't like about their genetic health care, which then led to the ministry funding us to create the Gene Equal Toolkit that we will talk a lot about today, and how you as healthcare providers or people from disability sector can use it. And while working on this project, we also thought, well, there is a big need on national level, and of course, the needs might be different across the different states. And so we were very lucky to also get funded by NHMRC, and we are busily working here. And meanwhile, as we were developing the Gene Equal Toolkit, and we were running co-production workshops and talking with our co-researchers on the team, it came very clearly that people need a tool that would help them to make decisions, whether, for example, they want to do genetic healthcare. And so this co-production then led to a new project, and we are now developing this toolkit. And parallelly, this was all about health from the beginning. And I'm saying that as an educator on the team, as a teacher. But people kept on telling us throughout these interviews and workshops, we want to learn about health and health literacy and how to make decisions and choices. We want to learn about it in schools. We need to, if we don't learn about it, then we are really disadvantaged. And that's where our beautiful university funded a few small seed programs, where we actually went to schools and we talked to students and also their teachers, and we learned that they don't learn about these things, yet it is in the curriculum. And the teacher said we don't teach it because we don't know how and we don't have accessible resources. And so I think one of the big things, so that was power of co-production that took us to unexpected places, honestly. But it's also that strength of our team coming from different sectors, and it shows how everything is interconnected. And it's, we don't have just one simple solution to improve healthcare outcomes if we just strictly look at health sector. So these are just some big learnings, and I'm sorry, I'm zipping it and passing it off to Sky.
So co-production and inclusive research are about partnerships, respecting and having trust with each other. So many people with intellectual disability has had bad experiences with genetic healthcare and also healthcare in general. There was a lot of lack of easy read information about genetic healthcare, and healthcare workers education was needed.
Thank you.
We decided to co-produce and evaluate so easy read information about genetic healthcare is what we're planning our research together, and education for healthcare health workers on how to do healthcare that uses reasonable adjustments, in person-centered. It is person-centered and also trauma-informed. We co-researchers add our expertise on easy read ethics documents. So we make documents accessible to people with intellectual disability. Easy read is a format with pictures on the left and words on the right, making and they're fitting together to make the sentence easy to read. Recruitment plans. how to run interviews and focus groups, and much more. We bring our lived experience. We are accessibility experts, and we know what will work and what won't.
And Sky, you are particularly amazing at reminding Eva and myself about the easy read rules that we forget regularly. But I think that that importance of what will work and what won't work, because again, like a little energetic bunny, I'll come along and say, we'll do lots of surveys. And then Julie will look at me and say, Emma, surveys are not going to work so well. So it's really lovely. We have a team meeting every fortnight when we all come together and talk about what we're doing. Sorry, all my other projects, but it is my favorite meeting of the month. And we often completely change track, don't we? Like we come together and we say, this is going to work, but really importantly, this is not going to work. And that's just awesome.
So we ran co-production and advisory workshops together. We co-researchers have trusted partnerships with self-advocacy and self-advocacy Sydney and other disability groups, other self-advocacy groups, and we facilitate the meetings and where everyone has respect, support if they need support, and a voice to speak up and share their experience and advice.
Thank you so much.
So the educational toolkit is now live, and we have 6 videos, 5 easy read booklets about genetics, and also tips and resources for healthcare workers.
And Sky is the main star for those of you who haven't seen the videos of these videos showing how to do and not to do genetic health scan.
Eva, I think you're downplaying your excellent supporting task.
Nodding.
Yes. And these are the videos, and we would absolutely love you to check them out because of all of our resources. I think we get the most powerful feedback from our videos. So this is showing my age, but there was a film called Sliding Doors, which was about basically one scenario, so one situation that played out, and then what would happen if that went out a little bit differently, and how much of a different impact there could be. So the first video shows, sadly, how healthcare often is for people with intellectual disability. And we know that because we wrote the scripts based on what our co-researchers said from the deep interviews and the focus groups, and we took them to co-production workshops, and people said, I identify with that. That is the experience that I have had. So it was people talking over people. It was people assumptions being made. It was very deficit-based languages. So we're using a lot of words about disorder and mutation and insufficiency. And then rewind. The second video in the pair shows how it would be if we're doing something, how people with intellectual disabilities say my healthcare should look. And honestly, that's how everyone's healthcare should look. So it's respectful and it's person-centered. And what does person-centered mean? It means I build a relationship as a healthcare professional with my patient. So I get to understand them, what's important to them, how they prefer that I communicate with them, and link everything to what actually is their needs. And that's if that person is a First Nations individual, if English isn't their first language, if their communication by verbal means is more challenging and we need to be using augmentative and assistive technologies, it's bringing it back to that person at the center. Because in health, what are we doing if we're not doing it with that person in the center? If this works, we're going to try and show.
So, it'd be good if I could get information about all Jess's problems from you before the doctor comes in. Perhaps if we could start with, whether she met her milestones growing up, whether she was delayed walking, talking, that sort of thing. Essentially, how she went at school, how severe her intellectual impairment is. Is that okay?
Yeah, absolutely.
Yeah.
It has been very difficult for a long time. She has been impaired since her childhood, and she didn't even go to school with normal children.
Just seeing that, hopefully that is just getting across in a few sentences, the absolutely shameful experience that many people have that I would say is not only traumatic, but, goes to neglect and abuse in that situation in terms of how that person is made to feel. And that's one of the main things we try and do with the videos is get people to reflect on, if you were in Jess's shoes, how would you be feeling? Would you be able to ask questions? Would you be able to feel comfortable to actually be involved as a healthcare consumer and get across and understand the information you need? Because you've been shut down right from the start. And then this is a snippet of take two, and how is that? Looking at David, how he's doing my noises.
And really, the most important thing is that you feel comfortable. This is your appointment. Can you tell me what you'd like to get from the appointment today?
I want to know why I have a disability and some health problems.
That's a great question. And look, I can't promise you that we will find an answer. I can promise you that we'll try. Also, in genetics, it often takes us a long time to find answers. So we definitely won't have an answer for you today, but I'm happy to explain to you the process, what's involved, and keep you informed the whole way. Okay. The other thing is, to help us find answers, one of the things we do is ask a lot of questions, but it's important that you feel comfortable, and if there are any questions that we ask that you don't want to answer, that's fine to say no. And really,
and I guess just reflecting, seeing that after a little while, Sky, how did it feel for you, like that second time round?
A bit more comfortable.
Yeah, sure.
Yeah. It felt too real the first time. It was like it was like, although it was acting, it was uncomfortable, and it brought back real memories of my experiences that I've had myself.
And that's what many people told us in the co-production workshops. And we just talking about co-production, you reminded me, Sky, we had a real discussion moment in our team. Do we actually share with people both videos, the take one, which is not very good experience, and take two, because we were really worried that to re-traumatize people, and it was people on the team, but also people in the co-production workshop told us it's really important that we show both, because they can on the take one really recognize what's not happening in their, and what's happening to them should not be happening, and it's wrong. But also they actually on the take two can see how the healthcare should look like, and what they have right to ask for. I think that was the really big moment. So that's why we then went with posting both videos. So there are many, it's many conversations in the co-production teams, isn't it? Trying to do the right thing and weighing.
And I think often in health, we are used to that kind of almost gatekeeper role or protection. So we're saying, oh, we shouldn't be doing that. We shouldn't show that. And then actually, it's when you talk to people and say, well, that was so powerful for me to have that experience. When we did put information, this is not how healthcare should be. This is how you can know about your rights. These are links to easy read booklets and self-advocacy organizations. And Eva, can I share what we got as a brilliant idea in the last co-production
Oh,
workshop?
definitely, that was the best one.
Which was that what we need to do next is show that first example and someone actually how they could negotiate that and stand up and advocate for their own rights. So rather than just seeing that kind of the onus is all on the healthcare professional to change, and we definitely want people to change, but also we want to equip people with the skills and the confidence that if they get a poor healthcare experience, they can say this isn't right, and how to do that in a way that's comfortable for them.
And to acknowledge, because we also talked with healthcare professionals and showed them the videos, people don't go into the profession to be evil or mistreat others. It just comes from the place of lack of education and lack of information. So the healthcare workers really appreciated that they can actually see what not to do and what to do in a very practical example.
Yeah, absolutely. And I think it's that people make assumptions. And I look at my own practice and how many assumptions I've made and I still make, and that I get it wrong and I keep getting it wrong. But at least it's okay in that I know I'm trying, and by having conversations and being inquisitive, then hopefully gradually I'm improving what I do. Because I think if we try to set ourselves up as, you know, we're all perfect and there's nothing we can learn, then what are we in this business for? These are amazing easy read booklets, which you can download. I can see Tyler's been busily putting links in the chat, which is awesome. And that's what Sky was so beautifully describing before, what easy read is, because I hadn't really seen easy read, but gee, it's great to have everything in easy read, especially meeting minutes. Just gets to the heart of things. And this is the key learning principles as well. So I think with the next slide, this is kind of like the landing page on the New South Wales Health website. And these are the 3 things we focused on. So how to make reasonable adjustments, how to ensure genetic healthcare is person-centered, and how do we practice trauma-informed care. And hopefully on the next slide, it kind of gives you that idea of we break that into very practical strategies that people can do in their own practice, you know, and also giving the legislation and the policy that says, yes, you know, you should be doing this. This is what people with intellectual disabilities tell you. And actually, this is a requirement in your practice. So sort of backing it up with that as well. And, you know, like we mentioned, some very practical tips, and there's lots of links that come out from that so that you can put into your place. And you might see the word genetic and you're like, well, I don't know anything to do with genetic healthcare, but we've got overwhelming feedback that this is relevant to all types of healthcare. So things like that, you know, a lot of people say, well, this will take more time and I've got these requirements. And so actually it's about, well, what are the Medicare item numbers you could bill to have longer appointments, to be giving the healthcare that actually fulfills your requirements and is in line with legislation. And the other thing that we did is we peppered throughout quotes from the interviews and focus groups and co-production, which was actually such a powerful tool. Health professionals told us it really resonated with them, and it made them think when they saw those quotes that this is actually coming from what people with intellectual disabilities say is how healthcare should look with, and that was really powerful in changing their motivation.
The second area of the key principles was the person-centered care. So I'll pass on to Sky.
So person-centered care is about listening to the preference of the person, their needs, and valuing each person. It means working together in a partnership with the person. Yeah.
Thank you, Sky.
Yeah, and this is a picture that kind of, you know, puts off what can happen is everyone is talking above and around and about the person, and not to and with the person themselves. And here's
Do you have a list of questions?
sorry.
No, yeah.
Here's me being a good doctor. I think I'm being a good doctor.
Yeah.
questions that you wanted to go through today? Because I really want to make sure we're focusing on what you want to talk about.
Yeah, we made a list of questions.
Oh, super.
Yeah,
Okay.
together.
Is that in your folder?
It's here.
Yeah.
Oh, here.
Yeah,
You got
yeah.
it. Brilliant. Okay, fabulous. So let me just pull up as well. I've got it on the computer. So what did you have at the top of your list? What was your most important question?
So I wanted to know how many people have this condition and how can I meet them?
Okay. Okay, what a great question. All right. So I have to admit something to you, which is I have never had a patient with CLCM4 before, but that is okay. It's a rare condition, and I've got lots and lots of patients. In fact, 1 in 12 people in Australia have got a rare condition. Okay, so although they're individually rare, there's lots of them. And so that's really normal for me. That's okay. And what we'll do is we'll just learn about this condition together.
Oh, it's awful watching self act. I don't have Sky's acting skills, but what we were trying to get across here was, you know, actually bring it back to rather than play sushi train medicine. So what sushi train medicine is that I go into the appointment with my list of these are the 3 things I'm going to get through this appointment. And then tick, I've done a good box. Tick, tick, tick. So that's the sushi train medicine, which is like in sushi train where it's going along and it's in a thing. And actually that's not healthcare, because I could feel I've done a great job. I've ticked all my boxes off. But if the person in front of me isn't interested or engaged or doesn't understand what I'm talking about, what was the point of that appointment? So it's really about bringing it back with person-centered care to asking Sky at the start of the appointment, what's important for you? And that's my agenda. And I might throw the other agenda out of the window, because actually that's the most important agenda. And the other bit to get across here was it is fine. And people do not mind as health professionals if we say we don't know. We don't know, but we'll find out. I'll reach out to someone. Let's come back. Tell me what you found out. Let's work on this together. And that's okay.
The next part that we will be talking
Do you
about
have a list of
is relevant to the third set of key principles around trauma-informed care. And I would like to start this part of the presentation with a trigger warning, because we will talk about some negative things that people experience, such as discrimination or abuse. And so feel free to leave the webinar, or if you want to talk to any of us after the presentation, our emails are on the slide, and I'm sure Tyler will put them also in the chat. So yeah, it's just really important to acknowledge that the topics we will talk about are not easy. So what we know from literature, but also from our own research, and not only related to health, is that many people with intellectual disability have had traumatic experience in their lives, and very often it included the abuse and neglect. And so it's really important that we as healthcare professionals, but also we as teachers, and we as you can at your profession, are aware of this. It doesn't mean we ask about this, but if I understand that the person that will come to my appointment has very likely experienced something very traumatic in their life, then I need to be very accommodating, very sensitive, and definitely not continue with the practice that would trigger even more trauma. I mentioned abuse, and unfortunately, we know that girls and women with intellectual disability experience at least once in their life sexual abuse in 60 to 90%. We don't have very exact number, but it's this range. And really, when we talk with people, though we don't ask about it, the experience tells us that's probably the high number is true. And so when we were doing the interviews about genetic healthcare, we did not ask these questions by any stretch, but some of the participants brought up this experience and how it affected them then in also attending their their healthcare. Another important thing that is relevant to trauma-informed care is to really understand that language matters. It matters what words we use about disability. And we've had these discussions a lot in Self-Advocacy Sydney, haven't we, Sky? And you've led a lot of those discussions. But if I look now back at the people we interviewed, so in the first project of our program, it was 19 people with intellectual disability, and there was not one person who wouldn't say at some point of that interview, I know something is wrong with me, I know I'm not normal, and that's awful. That's awful that the way we approach and talk about people, we are creating people who feel that they are less than others. And of course, then we are preparing perfect victims of neglect abuse because they will less likely speak up. And just the word normal on its own, I hear it so many times from teachers talking about normal students and the students with disability. I hear, and I know that they don't mean it wrongly, I hear parents using these words in front of their loved ones, and we hear healthcare professionals. And so we really need to start thinking about language we use. When we look at across the diagnosis of people we talked to, the 19 people I mentioned at the beginning, these were their diagnoses. I was particularly shocked that there is still mental retardation mentioned, which shouldn't be used anymore for quite a few years. But if you look at the others, deletion, insufficiency, abnormality, there is a really awful signal being sent to people. And some of the people told us, I'm not a number, or labels are for jars and not for people. And we found this particularly powerful. And so as part of the guiding principles on the website of Ministry of Health website, we also suggest positive and less discriminatory language, such as use complete terms like as intellectual disability, because for many people with intellectual disability and their supporters, the abbreviation ID is depersonalizing, and they don't like that. Say genetic condition rather than disorder, neurotypical rather than normal population, because honestly, what is normal? Sense of genetic condition rather than the risk of genetic condition, because otherwise what message am I saying to the parent about their child, but also potentially about themselves? So these are just some things that we would like you to think about and maybe take away with you. Have I forgotten anything about language, Sky? Because I know you've talked to people a lot about this topic.
In one of the meetings that we held at Self-Advocacy Sydney, like one of the clients said something about even her family member is calling her names and making her feel unworthy because of her disability. And other people were saying that they know of incidents where people have even committed suicide because of how they've been language has been used or how they've been bullied because of their disability. That's how
Thank you.
serious.
So it is serious, absolutely. And thank you, Sky, for sharing it. And I know it's not easy to talk about it. So thank you so much. But we do need to get that message out, don't we? So I will now, we have here another example of the good practice that I will play.
Sorry about that.
Hello, you must be Jess. Jess, I'm Jackie. I'm a genetic counsellor and I'll be with you for your appointment today with Dr. Bella. This must be Mary. We spoke on the phone. How did you go getting here? Was your trip
Very
okay?
well, thank you. Thank you for the
Sure.
directions.
Oh, that's all right. Thank you for coming in. I hope the traffic wasn't too bad.
It was okay, wasn't it?
Yeah. Well, look, not much fun sitting around in the waiting room. So if you'd like to come through to the room where the appointment's going to be, we can wait in there for Dr. Bella and have a bit of a chat.
Yeah.
Okay.
Yeah.
Now, Jess, you get to choose who you would like in with you for your appointment. Would you like Mary to come with you?
Yes.
Okay. So lovely to meet you.
You too.
Jess, have a seat there.
Thank you.
This is your appointment. So the main thing is I want you to feel comfortable and feel free to ask us any questions.
So one really particularly important point in this video was how often people told us at the co-production workshops that the healthcare profession talks only to their support person, really ignores them even in the waiting group or in the office, and they also talked about a lot, and Sky again jump in if I forget anything, but people shared a lot how they want to have a choice whether they bring support person in with them, and some people shared with us that then, though they know they would benefit from having a support person with them, they make the choice not to because they want to force the healthcare professional to talk to them and not to their support person. So this video was really role modeling what people said that they want. And I'll move on and pass on to Emma, if I can move slides.
Beautifully. And so if we remember those 6 steps right at the start, it's then about actually, the co-production means we're listening to people all the way through, but we also wanted to kind of get a summative at the end to get that feedback. So we did a reflection co-production workshop. So we were asking people not only about what they felt about the final resources, but about being involved in co-production itself. And we did talk to health professionals and bribe them to do a survey. I mean, not bribed, encourage them to do a survey. And a shout out to Manjika and Chloe, who are amazing students and junior doctors and medical students on the project.
And this
some of the feedback, yeah.
This workshop was a really wonderful opportunity to hear the voices and the feedback from people with intellectual disability on some of the co-designed and co-produced easy read resources that we made in the videos.
And we got some absolutely amazing feedback and really just some new ideas what we can do further.
I think this is a very, very helpful guide to help people with intellectual disability to access the right help service for them.
It's very easy to read.
It's very easy to read.
It has all the key information, but it's a guide to talk with their patient to at a like the same wavelength as them in an easy to understand conversation.
People really valued having both videos, that doctors should see both videos together to model some alternatives and strategies that they could use to make healthcare better.
Another one of the key things that came out was that the videos are quite beneficial as well for people with intellectual disability and their support workers, just to highlight what is better healthcare practice and what kind of care that they should be receiving, and to empower them to get that care.
I didn't realise just how much I'd informed to the first video. And once I saw that, things have started to change.
Heard how what to get support from, for when she wanted somebody to have the same condition and everything, and guided her and said, oh, you can go to Facebook and this is the website as well, and gave her the information.
And I appreciated that the doctor complimented Jess on a great question when it was asked.
It should be trained like a compulsory training in that.
It was a wonderful feedback from our co-production workshop. And over to Emma, what healthcare workers said.
Yeah, so we were very much guided by a brilliant collaborator of ours, Bronwyn Terrell, and she recommended that we use this framework, which was about, are we not only changing healthcare professionals, you know, what they say they do, their knowledge and their skills, but also their motivation to change. So that actual critical step that has to come of saying, I actually need to think and reflect on my practice. And there were some lovely quotes that showed that we were changing all of these. And for those people that are interested in statistics, I'm not one of them. One of those people, there's a paper which is under review at the moment, which showed we changed with statistical significance, all these things. Hooray!
Hooray, shout to us. And bigger shout out to Bronwyn, who also has a fantastic skills of doing web analytics. And so we were able to find out that our toolkit was visited and our videos and resources was visited by people from 53 countries. This is from October, so there might be more updated statistics, but we had more than 2,700 views, and with Easy Read resources 3,500 views. So it made us very happy that people are actually using the resources for change for the better.
And Sky, I think you asked like what fraction of the world is that or something that's seen our.
Oh, yeah, Sky asked how many countries are there in the world, which then Eva had to Google because of course she had no clue. And so we found out it's 1/4 of the world.
Quarter of the
So
world,
thank you.
which speaks to the lack of resources, doesn't it? That's out there, and how we like to think we're world leading, don't we, Sky? World domination. And on this, we do lots of talks together, and we were so sorry that Julie was not able to be here today, but it was lovely to see Julie in the video, and hopefully you could see like she is an amazing facilitator, and the respect and time she gives to people so that everyone can have a voice is just incredible.
So over to you, Sky.
So we've done lots of talk, and we've made easy read announcements, newsletters, which are easy read videos, and also podcasts about the toolkits. So what we've learned together with we talk about co-production, what it means to our team, what it means to people in our co-production workshops. It helps guide our next steps.
Thank you. And this is a reflection of people on what co-production means to them, being part of co-production. If I can make it play.
Great that we were all included in the process of the development of this book, because not only we gave our advice on how we the easy read, but it also benefited us too in receiving that information about Gene-Equal and what it's about, and how it can help us.
So just knowing the impact and how many people can help us today.
And this is what Gene-Equal is about. It's making things better.
Great that.
Right. And so we would like to also vary of time. We would like to end this presentation by a bit of reflection on what does co-production mean to us. And I will dare to speak for Julie, who cannot be here and who is not well. And so what she said that she really appreciates is that finally people at universities and academics, and as people, as always says, people from ivory towers, work together alongside with people with intellectual disability, and that means a world of the difference. Another thing that Julie said she really appreciate is that we play to our strengths, and so people choose the work they want to do where they have strengths, or they choose the work that they want to learn, though they might not have the skills yet. And in our team, we also say what are some tasks we really don't want to do. And we have one category, which is what are the tasks I don't want to do, but I could be bribed to do it, and what's my bribe? So we have a ways to work around this. And absolutely must for Julie is that thanks to co-production, we really can do research about things that are important to people with disability. Sky.
So co-production means that to us is respect, being inclusive of everyone in the team, empowering each other and learning together. We all learn from each other and making changes together.
Thank you so much, Sky. So speaking for me, I think it's a must. I cannot imagine doing research any other way. I think that thanks to co-production, we really get to issues that matter to people at the heart of our research. And I must say that inclusive research has taken me on the journeys that I would never have thought that I will be doing research about. And it's just really listening to people. I think the cooperation empowers all parties involved in the research, but also challenges them. I think that's fair to say. And it's, I think a big thing is that it's never ending learning. And we all say the saying, one size doesn't fit all, but that applies also to co-production. And so what works with one group will not work with another, or what works with one person will not work with another. And so it's always just being reminded that we are learning, and maybe be kind to ourselves if we make a mistakes.
That's mine, which you can read. We've got 2 minutes left, so maybe we move to our wrap-up slides. Eva,
Okay.
we've got
So this is just reminding you how we walked you through our program and how we work. And we already talked about how we are now doing research that is that in our national project that includes Aboriginal and Torres Strait Islander people, and it's a beautiful 5-year journey when we can make a difference in genetic healthcare in whole Australia. But we are also working at schools, and so we've talked with students and teachers and family members, and we continue to learn what they want to learn about, and that is really our next step. And our last slide, please get in touch with us. We would love to hear from you.
and we're always got something going on, don't we, Sky and
Oh,
Eva?
totally.
We're recruiting at the moment. We would love to hear from healthcare workers about their experiences, what they think makes an appointment go well with people with intellectual disability, what they find they would love to have some more resources on to help improve their practice, or what's been working well, what's not been working so well. And in schools, Eva, what's our main project at the moment?
We really want to talk to family members, so parents of young people, high school students, and up to 25 years of age, to learn about their experiences of how their child is taught at school about health literacy.
And we also do beautiful newsletters, and so you can sign up for our newsletters, and we record them as videos as well. And do we say that there's maybe a podcast series coming soon?
Yes, we have a podcast series coming. Yeah, and we should play our Genico music. And we are very excited. It will be targeting families. And this is something that families told us across Australia that they really want and need. And the podcast series will always cross health and education.
And a huge thank you for the National Centre for this opportunity to present today, and Tyler for keeping us all on time and beautifully together for all the tech issues. And yeah, we'd love if people want to email us or reach out. We're always looking for conversations and sharing.
Thank you. And we'll move on to questions if we have at least a second.
There's just one question that I'll throw out to you, and if there are any more that come in, we're happy to send them to the team and get those answered afterwards. But I just want to put out the question there of, for healthcare workers who aren't currently working specifically in genetics, how can they best use these tools?
I would say just check them out, because I actually think a lot of what we've got there is relevant across healthcare in general. So, you know, the things like about how to make reasonable adjustments, working out what your legislation is, what you can advocate for as a healthcare worker to your line manager. I think that's often part of it. I would, you know, there's part of it which is genetics and the language and things, but actually most of it is about good healthcare. And watch this space. We've got more resources coming out.
Great. I'm going to be cheeking us one really quick one that's just come through. Has the co-production team discussed possibly giving any tips for support people who might be attending appointments with the person?
Yeah, absolutely. And I think, you know, at the end of one of those videos, there was a person who was a support person. She had a mask on and she was saying she'd realized how much she'd conformed. And this keeps coming up, doesn't it, Sky and Eva, that often it is the very well-meaning person that's sitting alongside the person who's actually sort of complicit in this shutting down that's happening. So we absolutely, in our national project, that is a group of people we're talking to. And that's one of the main things of our secret, but not now so secret podcast series is about communication tips and actually how we can break through and help people understand how they can be more a support person as opposed to a carer. So it's on that person's terms. And it's a little difference in a word, but I think it makes a big difference. We tend to talk about support people as opposed to carer.
Sky.
We had this discussion at Self-Advocacy Sydney about like supporting or helping or caring for. So instead of doing something for the person or taking control of the situation, you're supporting them to be their best or to reach their goal. So you're more equal rather than helping and handing a hand down, giving a hand down.
You said it the best, Sky. We wouldn't have said it that way. That's exactly the spirit of the podcast. Thank you.
Thank you all so much. I want to give a big thank you to our lovely presenters today, Sky, Eva and Emma. It has been wonderful. And Julie, who also put a lot of work into this, but unfortunately couldn't join us today. Thank you to David and Sandy, who are our interpreter and captioner here today. And just before we wrap up, I'm going to share a quick video that just talks a little bit about what the National Centre of Excellence is. This was only just recently released and it's only 2 minutes. So if you can stick around, we'd love for you to do that. Otherwise, you can watch it on the National Centre of Excellence YouTube channel.
Hello and welcome to the National Centre of Excellence in Intellectual Disability Health.
We call it the Centre for short. This centre makes sure people with intellectual disability get better health care.
At the centre, we talk to people with intellectual disability to find out what they think is important.
We talk to families and support people.
We work with health services and disability groups.
We bring information together from across Australia.
We share information about how to make good health services for people with intellectual disability.
We make sure there is health information for people with intellectual disability, families and supporters, health and disability workers.
We speak up on the big health issues and drive positive change.
There are 9 main groups in the centre. We call this the Consortium. There are also more than 50 wonderful partnering and collaborating organisations. People with intellectual disability are a big part of the centre. People with intellectual disability work at the centre.
We're excited about improving the health and well-being of people with intellectual disability. Please join us.
To find out more information, go to our website nceidh.org.au and sign up for our news.
Welcome to the centre.
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 Yay!
Thank you everyone who stuck around to watch that one. We really appreciate your time today, and a big shout out again to the Gene Equal team for the work they've done. The National Centre of Excellence is really proud to have been able to put this on with you and share this information. If there are any questions, my email has been shared, or you can visit the Gene Equal website to access all of those wonderful resources. Thank you so much everyone, and we will hopefully see you at the next one. Thank you.